In this study, we investigated association between CGM-derived glucose metrics and all-cause mortality in patients with type 1 or type 2 diabetes in the Department of Veteran Affairs. We obtained CGM device data from Dexcom company and merged them with VA's EHR data. Participants had to at least 10 days of CGM data during 3 landmark periods, which were defined as the 14 days, 3 months, and 6 months after starting CGM. We then assessed the all-cause mortality over 5 years. Using Cox proportional hazard model, we evaluated how CGM metrics, including mean glucose, time in range, time above range, coefficient of variation, and glycemic risk index related to mortality. We also compared these metrics with landmark HbA1c values extracted from EHR. We had about 2,700 participants, and there were around 400 deaths occurred in this dataset. The slide shows panelized plan plots from age-adjusted Cox model using 6 months exposures. These plots revealed a J-shaped relationship between HbA1c and mortality. For CGM metrics, the association with mortality were linear except for mean glucose, which was nearly linear around a reference of 178 mg/dl. To the right, we show our multivariate Cox model's result. In the middle, we adjusted for other mortality-related factors. We found that higher mean glucose, TAR, CV, and GRI were linked to increased 5-year mortality, while higher TIR was protective. All the results are highly significant. This association remained significant even after accounting for landmark HbA1c. The results are shown in the red box. Our results were similar, using shorter observation window and across T1D and T2D groups. In summary, our large real-world study demonstrates that CGM-based measures of glucose control predict serious risk, including mortality, even more effectively than current or past HbA1c levels. These CGM metrics show largely linear relationship with mortality, indicating no clear cutoff points. Our results also suggest that both glucose patterns and fluctuations are critical for clinical outcomes. In conclusion, CGM metrics may enhance our ability to stratify patient risk and provide actionable targets to reduce mortality in both type 1 and type 2 diabetes.